Good morning, good evening, good night, doctors, nurses, and pharmacists. I'm DrChe, and today we will continue this speaking class, speaking feedback class. Okay, so just let me share the session with other doctors and nurses, and then we will continue. So we will be doing the nursing role plays, and we will be doing doctor's role plays also. Two doctors role play, two nursing role play, okay, if possible. So just let me share the session. If you people can share the session with other doctors, nurses, and pharmacists in other groups, that would be great, okay? So my system a little bit slow. Just a minute, please. Let me. Please mute. Please mute. Okay. So now let us start. You people can see. We have a lot of people today. Okay. So thank you, all of you. So now first we will do doctor's role play and then we will do nursing role play. So Dr. Dilawar will do first role play.
Yes, sir.
For nursing, for doctors. Okay, so let me share it with you. The screen. Okay. Can you see the role play on my?
Yes, sir, I can see.
Okay.
Sir, before we start,
Yes.
I would like to share my little experience because I did the exam
Yeah.
before, and
Yes,
maybe
please.
giving some tips for doctor and nurses, if it's okay.
Okay. Okay. Good. Thank you.
Okay, actually, it's my second attempt because I did the exam before and I failed in writing, like I passed in speaking. I advise nurses and doctors to book your speaking exam as far as possible because what the OET team will do, they will create 5 cards, no more than 5 cards. And for the rest of the exam, it will be 4 or 5 days. All 5 days, there will be 5 cards and you will get 2 cards. So try to get as far as possible, for example, at the end of the day of the exam, in order to get the task from your friends, you know? And it helped me a lot during the exam because when I got my cards, one of the cards it was a tricky card, and I would like to share it with you because I never saw this trick in any cards. There was a patient that went to a nurse, and the nurse told the patient you have sinusitis, then referred the patient to you as a GP. And when you took history and you examine the patient, you will conclude that the patient has nasal polyp, not sinusitis. When you explain the diagnosis to the patient, uh, the interlocutor asks you, okay, but the nurse told me you have sinusitis, not nasal polyp. So, you know, what the nurse did is something wrong, but you cannot say like that, okay, the nurse did something wrong. You have to be, you know, a polite, because be like ethical, in ethical way, you have to tell the patient the nurse did something wrong. So what I did in the exam, I said, okay, the nurse is one of the staffs of our healthcare system. He did great job by taking your complaint in a consideration and referring you to me. And I said those stuffs. I didn't directly told the interlocutor, okay, the nurse did something wrong. So that was one of the tips. Like
Yeah, that is true.
I got
That is
before
true,
the
Dr.
exam.
Dravar. Yeah, thank you. That is true that if there is some mistake by anybody and there is not intentional mistake, okay, maybe we can understand something in different way. So we should not, blame anybody in our
Yeah.
consultation. So that's good. Okay. So I didn't share, this Zoom link with most of you. Some of you have shared this link. Please don't share. Okay. Because today's class was on Facebook, not on Zoom. Okay, please don't share this. Okay. Okay, so Dr. Dalavar, this is your role play. 2.5 minutes to prepare, please. Okay. So first we will do doctor's role play and then we will do nursing role play. Okay. 2.5 minutes to prepare, please. This is your role play. Nurses can also see and prepare. Okay. Thus you will people will also get help. Okay. 2.5 minutes to prepare, Dr. Dalavar.
Okay.
Those who have joined now, just this is preparation time. The doctor is preparing his role play, then we will start. Okay. Okay, doctor, let me know when you are ready to
Okay, sir.
start, please.
Okay.
Just 1 minute. Let me just check some stopwatch here. I don't have any stopwatch. Can any of you use the time? No, let me try somewhere else. Okay, start, please.
Hello, good morning. My name is Dr. Laur. I'm the treating doctor for today. And how can I address you, please?
Yes, doctor, you can call me Smith.
Okay, Mr. Smith, nice to meet you. And how can I help you today?
Uh, Doctor, I'm here because I am, feeling
Mhm.
tired all the day
I see.
nowadays, doctor. Yeah.
Mhm. Okay, can you please tell me more about your condition?
Uh, yes, doctor. Actually, you know, uh, as you can see, I'm a little bit, overweight.
Mhm.
And the problem is, doctor, I didn't notice anything, but
Mhm.
my wife, yeah, she is here with me. She
Mhm.
has noticed that, she says that I keep snoring at night,
Mhm.
and then sometimes I stop breathing for a short time,
Mhm.
and then I take a gasping deep breath. I don't know why, doctor.
I see.
And
Oh,
and it's not easy for me, doctor.
yes.
Can you hear me?
I'm really sorry to hear that. Before we proceed, I would like to ask you a few more questions.
Yes, please.
How does it affect your daily life?
uh, Doctor, that is a good question. As I told doctor, I feel tired at the day, and sometimes I get a little bit dizzy also.
Mm-hmm.
Yes, it is affecting my ability to work,
I see.
and also this issue is affecting our uh, matrimonial relationship, doctor.
Mm-hmm. Oh, I'm really sorry to hear that. Uh, Mr. Smith, do you have any problem during a day, like feeling sleep during the day?
Doctor, I already told you that yes, I feel dizzy.
Okay. May I examine you, Mr. Smith?
Yes, yes.
Okay. Based on the symptoms and my examination, I suspect a condition called sleep apnea. Have you ever heard about this?
No, doctor, what is this?
Okay, Mr. Smith, let me explain it to you. Sleep apnea is a disorder in which there is a pause in breathing during sleeping, and also sometimes there is loud snoring during sleeping at night. Am I clear so far?
Yes, doctor, but what should I do, doctor?
Okay, Mr. Smith, I would like to explain the lines of management. Uh, in this condition, we usually use a machine called CPAP. This is the first. And the second thing is using breathing device. If not improve with that, we can shift to a surgery. But the first line is using a conservative treatment, which is the breathing device. If not successful, then we can shift to the surgery. Am I clear so far?
Ah, okay, doctor, okay.
Do you have any other
Okay, so can
concern?
you give me some sleeping pills? Can you give me some sleeping pills, doctor? They can help me because I cannot sleep well at night.
Mhm. Okay, I appreciate your concern. Actually, Mr. Smith, I'm really sorry to say that the medication are not helpful in this condition.
Uh, Doctor, but one of my friend had similar problem and he could
Mhm.
not sleep well and he is taking sleeping pills and he is improving. He sleeps
Yes.
well.
Yes, I appreciate your worry. Actually, this condition is different. Usually, the medication are not helpful in this condition. You have to take other measures, as I mentioned before. Mr. Smith, I would like to discuss the prevention for this condition in order not to occur again. Is that okay with you?
Yes, what please?
Okay. Number one is decreasing weight. Number two is doing more exercise. Number three, which is the most important one, is avoid drinking alcohol and smoking. And the last one is avoiding driving for a while. Do you think you can do that?
Okay, doctor.
Okay. Do you have any concern, Mr. Smith?
No, doctor.
Okay. I wish you a speed recovery. Please, if you have any queries, you can contact me.
Okay, thank you, doctor.
Okay, thank you, doctor.
So we have done a little bit more than 5 minutes. Like not a problem.
Mhm.
Overall, Dr. Dlava, your role play is good. I will give you B grade, okay? But there is some issue,
Okay.
okay? First of all, you are a bit over slow. You don't need to be too slow, okay? It's good that you should understand the patient. You should explain the things. That is good, but not be over slow, okay? Be a little bit fluent, a little bit fast, okay?
Mhm.
Don't become over fast because then the patient will not understand what you are saying, okay?
Okay.
So be fluent, be a little bit. It looks like you're looking for words and sentences to complete your
Mhm.
conversation the way you go slow. It's not good, okay? You need to be a little bit more fluent, okay?
Okay. Okay.
And your start was good. You asked my name. You asked, I told you. As all of you, I didn't tell him in detail at the start. I just told him, okay, doctor, I'm here because I feel tired these days. After that, when I tell a little bit thing, you need to do is you need to ask an open question. So when you ask an open question, the patient, okay, the patient will be able to answer the other symptoms, okay? So he will discuss the other symptoms, other things that patient wants to discuss, okay? That is good that you have asked an open question. And then you ask, does it affect? No, affects, no. Does it affect? Because after does, we cannot use SRES, okay? Does it affects? No, does it affect? You should show good sympathy. Whenever I told you that there is something problem with me, it is affecting me, you showed sympathy. That is good, okay? So there was no need to examine me because it's not written in your role play that you need to examine the patient. Don't just waste your words and time because it is not written. Just cover what is written in your role play. This is not a medical exam, okay? So you told according to history and my examination, okay? So that is a little bit medical style, okay? You are talking with a patient, you're not with you're not taking any OSCE exam. So just saying according to history and examination, a little bit medical style. What we can do instead of this, anybody can tell me on Zoom?
Yeah, we can say that after listening to your symptoms
Uh-huh.
or after seeing your
No,
condition, I
listening to
can
your
say
symptom is
that
not
it
good.
probably
No,
is
after
sleep apnea.
seeing your condition is not good. Listening to your symptom is also not good. It's very easy. Just Mr. Smith, according to what you have told me, it seems to me that you have a condition. that we call as sleep apnea. Okay, very easy. So, Mr. Smith, according to what you have told me, it seems to me that you have a condition that we call as sleep apnea. Do you have any idea what is sleep apnea? Okay, then you will explain. Ask, you will explain. Okay, so if not improve, at one point, Dr. Lavar, you said if not improve, this is grammatically wrong. If it does not improve, if it does not improve with conservative treatment, then we can try surgery. Okay, there is we have other option, surgery, surgical option. Okay, and at the last point, you are messed up very. You said number one is decrease weight, number two is exercise, number three is avoid drink and cold. So this is not good way. You need to make sentences instead of just numbering. Okay, number one is weight, decrease weight, number two is exercise, number three is avoid drink alcohol. This is not good way. What we can do here, we can
Or
use
We can
can,
discuss
sequencing.
that,
yes.
We can use sequencing. That is good, but sequences is not like number one, number two, number three. Okay, we can say, okay, Mr. Siva, there are some things that you can do to avoid this problem in future. That would that would help you to improve. So first of all, is if you decrease your weight, it would help you a lot in improving your symptoms. Okay, doctor. Then pause. Patient will respond. Okay. Another thing, first of all, another thing that can help you is exercising regularly. Okay, and also please avoid to drink alcohol and and avoid smoking. Okay. Okay, thank you, doctor. Okay, at the end, Mr. Smith, I would highly advise you not to drive while at the day, because if you are dizzy, you might get some issue. So please avoid driving also. So this is how you can do the last uh, bullet point. Okay. So try to improve a little bit more, doctor, to get a clear and good,
Okay, sir.
B grade. Okay. So now one nursing role play. Let us do. So Miss Nuna is there. Miss Noona
Sir?
is there. Yeah,
Yes,
are you
doctor.
there?
Yes,
Okay.
doctor.
Okay. So let us try with you this role play. So now one nursing role play. After that, we will do one more medicine role play and one more nursing role play. Okay. So this is your role play. You have 2.5 minutes to complete. So are you ready?
Okay, doctor.
Okay, just give me 1 minute because I need to see quickly the roll pill. Okay, start please. Start please.
Hello, good afternoon. I am the charge nurse of this emergency department. How can I help you, sir?
Nurse, I am here because we are here waiting for more than 2 hours, more than 1 hour, and my mother is sick, and nobody came here to take care of her. We are really worried.
Oh, don't worry, sir. I understand your concern. Uh, because be calm and sit down because now in this emergency department there is a mass casualty, so that we are busy and our doctor and nurses are busy there because they are looking for the serious condition. Please just wait and sit, okay?
How can I sit, nurse? My mother is sick, and we have been waiting for more than 1 hour. So it is very tiring. She is very sick. She is sick like other people. So why nobody came here to attend her?
Okay, become, sir. I can understand your situation. I am here to serve you. Please, could you tell me about the sign and symptoms of your mother?
Yes, nurse. She has dementia like this, and but
Okay.
now recently she became confused, and she is having
Okay.
some problem with her urine, and she goes to washroom frequently, and she wets herself.
Okay. Okay. I got your point. Okay, please. As you know, your mother is a dementia patient. Please don't worry. It's not a serious condition. Please. Please understand, there are a lots of serious condition now in our emergency department. Uh, Emergency department. Then your mother. This is not a serious condition. So just feel relaxed and just don't worry. I will check the vital signs of your mother until the doctor will arrive soon. Okay, is it okay to you?
Uh, okay, but why the doctor didn't come? Doctor, nurse, my mother is sick. She is having problems with the urine. She is confused. She is sick.
Okay. Telling about your mother condition in dementia case, she has this kind of problem like urinary incontinence, and she will forget the things. But there is no need to worry. While I say I will check. I have checked the vital sign, and there is no need. There is no need to worry till now because all the vital signs are in normal condition except the temperature. She has a fever, but she had she has fever, uh, uh, in this condition, in urinary, oh, sorry, in this, uh, well, there is a fever in such situation, but no need to worry. After the medication, she will be fine, and doctor will prescribe some medication for her. Are you okay then? Is it okay
Okay,
for you?
okay,
Okay.
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 So, will you ask me anything else at the end? Do you have any other concern? Do you have any question? Maybe like this, okay.
Okay, sir. Do you have any concern or any queries about this related?
One of these things, one of these, not all of them. Okay, so just those people who are with us on Zoom and on Facebook, please, please note that she is totally new to speaking because this is her first attempt and you have not tried any speaking role plays before.
No, never,
Uh,
doctor. This is my first attempt.
yeah, this is, but it's very good. Okay, very good. Okay, so you will improve with time. Okay, don't worry. Okay, now I will tell you how to do the role play. Okay, and then you will do again. Okay,
Okay.
okay. First of all, introduce yourself. Okay.
Okay.
Good morning. I am Dr. Radha. I am Dr. Nena, whatever you name, what you name want to use. Okay.
Okay.
I'm Diana. I am Diana, one of the nurses here in the emergency department. Okay. You can ask my name during preparation time. How can I call you? How can I call your mother? Okay. During preparation time. This is one thing. Other thing is you can ask me at the start. Could you please tell me how can I call you? Yeah, you can call me Diana. Okay, you can call me Jenny. Okay, okay, Miss Jenny. I can see that you are here with your mother. Just telling that you are here with mother means you are not my patient. Your patient is my patient is your mother. Okay, I can
Okay.
see that you are here with your mother. Could you please tell me how can I help you today? Okay.
Okay, doctor.
Nurse, we have been waiting here for more than 1 hour and this and that and that and that. So I will be angry. Okay.
Mm.
So what is your role play? What is your role to do here is you need to apologize. Miss Jenny, I'm really sorry you have to wait for a long time. I can see that it is not easy to wait, but let me tell you that all the doctors are busy in attending. They are attending some emergency cases. Don't say there are many casualties, mass casualty. Okay, so the
Okay.
doctors are busy. They are attending some emergency patients. So as soon as they get free, they are available. They will see your mother. Okay.
Okay.
Don't say
Okay.
directly, please calm down and sit down. Okay. This is not good. Okay. Don't directly say.
Okay.
This is the way to calm me down. Okay. Then I will say, no, no, we have been waiting this and my mother is sick. Then how they can attend other patients? My mother is also emergency patient and this and that. Yes, Miss Jenny, I totally understand that your mother also needs, immediate care. But let me tell you that other patients are in more serious condition, but we will also see your mother as soon as our doctors okay are available, and please don't worry, we will be taking care of her. This is the way to calm down the patient. Okay. Okay.
Okay.
And don't directly say calm down. Okay. So okay, so looking for I think something you have said. I have written here, but I don't understand what I have written. Okay. So they are seeing looking for something. Okay. I got your point. It's okay. If I say anything, you can say I got your point. Okay.
Okay.
So then don't say she a dementia patient. She forgot things. She forgot is grammatically wrong. In
Okay.
mostly in dementia patients, forget things. Okay, you can say like this. Okay, use
Mm.
present tense. Okay, so then do you need to reassure? Yeah, let me miss Miss whatever you use my name.
Mm.
Miss Jenny, let me reassure you that this is not a serious condition, as serious as other patients. This is not a serious condition. She will be fine. She will be okay after we treat her. Okay, please don't worry. Okay. So then ask, is it okay, Miss Jenny, if I can take vital signs of your mother so that when the doctor comes, so we have, the vitals are vital, signs in our hand. Okay. Yes, you can do whatever the patient says. Okay. And then explain, you know, the patient will, maybe patient again say, no, why you people are getting too late, and then you can again reassure and then ask what you need to do. Check the vital signs and explain the vital signs. Okay.
Okay. Okay,
Okay.
doctor.
So let us do it again. Okay, because you need to improve. Start.
Okay. Mm. Good afternoon. I am the nurse in charge in this emergency department.
No,
How ca-
use your name. Use your name.
mm, Good afternoon. Uh, I am I am Miss Nuna. I am the charge nurse in the emergency department. How how can I help you?
I can see that. Just you don't know my name. If you want to use my name, use. Otherwise, ask my name. Yes, nurse. I am Jenny. My name
Okay.
is Jenny. Okay. Then ask how can I help. Okay, Miss Jenny.
Mm,
I can see that you are here with your mother. How can I help? Tell. Ask, please.
Okay. Mm. Good
Start again.
afternoon. Okay.
Yeah.
Okay, baby. Good afternoon. Uh, I am Miss Nuna. I am the charge nurse in the emergency department. Uh, uh, how how can how can I address you?
I am Jenny, nurse.
Okay, Jenny. Uh, I am uh, I don't know sir how to.
Okay. How can I help you? How can I help you? Just ask me how can I help you?
Okay, okay, Jenny. How can I help you?
Miss, I'm here with my mother. My mother is sick, and we have been waiting here for more than 1 hour. Nobody came here to see my mother. I'm really worried. You people don't care about my mother.
Okay, Jenny. I understand your concern. Please, uh, please, there is a serious case in the emergency department, and the doctors are busy for looking the serious condition. Uh, so, mm,
So what? Okay, don't worry. Okay, try to improve. Okay, I will send you the
okay,
recording. Okay, after class. Okay, just will send you the
okay,
recording. Then
doctor.
you can
Next
listen
time I
and you
will.
can improve. Okay, yeah. But overall, the way you think that you are not good is not the way. Okay, because you are overall good. Just you need to improve and work on your. So you can watch some YouTube videos how you need to improve and these things. Okay, and
Okay.
then we can with our classes and these things we can improve. Okay, so Dr. Wasim, do you want to do one role play? So nurses after that, after doctors, are
Yes,
the
sir.
nurses. Okay.
Yes, sure, sir. I'm all ready.
Okay. So let me show you the role play. Okay, so this is your role play. 2.5 minutes to prepare, please.
Hello, sir. Can you hear me?
Yes, I can hear you. Just in preparation time, you need to prepare your role play in 2.5 minutes. Is that okay? Can you hear me, Dr. Wasim? I think he has some problem with connection. Dr. Saman?
Yes, sir, I can hear you.
Okay. This is your role play. 2.5 minutes to prepare, please.
Right, sir.
Hello, sir. Can you hear me?
Yeah, that Dr. Saman is doing, we can do at the end again. Okay, doctor? Don't worry. Dr. Wasim?
Yes, sir. Can you hear me?
Yeah, I can hear you. No, Dr. Saman is doing the role play. We can do with you at the end, okay?
Oh, okay, sir.
Okay, let me know, doctor, when you are ready, please. Should we start?
Yes, sir.
Okay, let me start recording. Okay, start, please.
Good morning. My name is Dr. Saman, and I am the resident in the surgical department. Can you please confirm your name and age for the medical records?
Yes, doctor, I am John, and I have 80 years.
Good to see you here. How can I help you?
Uh, doctor, I was operated here 1 week ago, and now the problem is I have, I'm not feeling well.
Before proceeding further, I just want to ask few questions regarding your condition. Why are you not feeling well? What happened to you?
Doctor, what happened is, I underwent this problem, the surgery of my fracture, and then they have given me some medication, and the problem is now I feel my tummy is becoming hard, and I have not passed stool for the last 3 days.
Oh, I'm really sorry to hear that. I know it might be so painful for you. Um, can you please tell me when did your symptoms start?
Doctor, 3 days ago.
How many times you open up your bowel?
I have not opened up for the last 3 days.
Have you been experiencing any other symptoms like vomiting or fever?
No, doctor.
Please tell me about the surgery. What kind of surgery you underwent 1 week ago?
Just I was at my home. I had a fracture of my femur, and they have done the surgery.
Stressful for you right now. As you told me, you take some painkiller, cocodamol, and would you
No,
like
I
to
didn't
tell
tell you,
me
doctor.
how?
Doctor, I didn't tell you I take cocodamol.
Which medicine you take for your pain?
Yes, they have given when they discharge me, they have given me this this to people called cocoda like this. Yeah.
Yes. And how often you take this medicine?
They told me to take 2 times in a day, one in the morning, but one in the evening. But doctor, this medication is a magic. It relieves me when I take this medication. It relieves me pain immediately. So I was taking quite often, like 5 or 6 tablets in a day.
Can you tell me the dosage of this medicine?
Yes, please.
Can you please tell me the dose of this medicine?
Yeah, I'm taking. They told me to take 2 times, but I'm taking 5 or 6 tablets in a day. They told me to take just 2 tablets.
Well, based on your history, I believe that this medicine is the cause of your constipation, and you are taking it in a lot of quantity, as you have to take it just twice. You have to take twice a day. So, and basically, you as you have underwent the surgery for your femur fracture, so immobility is also the cause of the constipation. So, am I clear to you?
Yes.
Do you want to ask anything else?
No, doctor, what should I do now?
Yes, I will provide you with the different non-pharmacological interventions that will alleviate your symptoms. Would you like to hear that?
Yes.
Right. I'm very happy that you are very much concerned about your health. You have to take high fiber diet, and you have to do some exercises while lying down. And furthermore, I advise you to take plenty of fluids that will help to soften your stools. And I will also change your painkiller, as it's causing you constipation. And you can also take laxatives or some stool softeners that will help you a lot. Am I clear to you?
Yes, doctor. Okay. But doctor, one of my friends had, constipation, and for her. Can you hear me?
Not hear your voice. No, sir.
Can you hear me now?
Yes, sir.
Okay, doctor, one of my friends had constipation, and the doctors have done surgery for her. I'm really worried. Do I need any surgery?
No, I reassure you that if you will follow these non-pharmacological interventions, you will get better. Surgical interventions are not required in your case, and hopefully these interventions will help you a lot. But if you
Okay.
find that your symptoms are not um, uh, are aggravating, so you can come at any time and you can consult with me.
Okay, doctor. Thank you.
Is there any concern that needs to be
Mm,
addressed?
No, no. You need to take care of your time management because we have taken a lot, more than 5 minutes for this role play. Please be careful about time management. Okay. Okay. So you don't need to say, may I ask your name and age for the medical record? You don't need to say medical record. Okay. Just may I know your name and age, please, if you want. Okay. Don't say medical record. This is not good. Okay. Your empathy was good from the start was good. Okay. And okay, you don't say the based on history. You're not taking any OSCE exam. You're not doing any interview with, uh, any exam for a professor. So don't say like this, okay? Based on history, just Mr. Smith, based on what you have told me, okay? So history, no. Overall was good. Here in this point, you made one mistake that you have given all the things in one go. You told me that you need to do you need to ambulate, you need to take a high fiber diet, you need to exercise, you need to take plenty of fluids. Also, I will give you other medication, other painkiller, and please use laxative, whatever. Okay. So you can see how many things are there. A lot of things. Okay. A lot of things. So if you explain them like, like you did, okay, in one go, it would not be easy for the reader to understand what you are saying. Okay. So please be careful. So you need to divide it into at least two or three, chunks. And not say again and again non-pharmacological, because non-pharmacological is a term for us. For the patient, no. We don't need to use the term non-pharmacological for the patient. Okay. Just Mr. Smith, there are some measures that you can do that would help you in relieving your symptoms of constipation. For example, you can try to walk on regular basis. Okay, try to exercise. You can eat a diet that should be high in fibers, and please drink plenty of fluids. What do you think about that? Okay, doctor, I will do. And also, as I told you that cocodamol, this is the painkiller that you are taking, could be the reason of your symptoms, as you are taking more than prescribed. That could be the reason. So I would give you an alternative analgesic, an alternative painkiller, don't say analgesic, an alternative, painkiller. And I would also advise you to use some laxative to relieve the symptoms of constipation. Okay, just to relieve the constipation, maybe like this.
What about the last point? Reassure about surgical intervention for constipation.
Okay, so this bracket means this is what you can use to explain. Okay, so you will say, Mr. Smith, first of all, I'm really sorry. As I told you about my friend, she had to undergo this surgery. First of all, show sympathy for my friend. Okay, Mr. Smith, first of all, I'm really sorry about your friend that he has to undergo the surgery. But on the other hand, don't say on the other hand, but let me reassure you that in your case, this is just a moderate constipation, and in your case, the treatment would be effective. Okay, non-surgical treatment or treatment other than surgery, yeah, just normal treatment would be effective in your case. This is how you will explain. Okay, doctor. Overall is good. Just we still have time, and we will be practicing on regular basis. You are one of my students, okay? So you will improve with time. Okay? So just okay. So I will give you C plus because the time management was also issue. Okay, but it's not bad. Okay, yes, English is not bad. Okay, it's good. Okay, so with time we will improve. I will send you the recording. You can listen yourself.
Yes, sir.
Okay. So now one nursing role play. Let me see. There was one nurse. Okay. Just one minute. Miss Takshila Dilani. Miss Takshila. Dr. Dilawar, it is not mandatory to finish all the tasks, but if we can, that would be good because we will not lose marks if we don't finish all the all the bullet points. Okay, we will not. So Miss Takshila, please other people mute and only Miss
Yes, sir. I'm
Takshila.
here.
Yeah. Okay.
Yes, sir.
Other people please mute. Okay. Okay. So now let me open one role play for you. One nursing role play. This would be the last role play because I need to take the normal, my VIP hybrid class, the writing feedback class that is normal for us at 5 p.m. So 4 role plays are enough for today. Maybe we can arrange any other session, any other free session. Okay. So Miss Takshila, this is your role play. 2.5 minutes to prepare, please.
Okay.
Are you ready?
Okay, sir.
Just 1 minute. Let me start recording. Okay, people on Facebook, can you hear me? Okay, so today I wanted on Facebook because on Zoom, speaking is not easy to do on Zoom because people start, you know, unmuting there. Okay. So writing is on Zoom. Okay. So Please start. Okay.
Okay. Good morning. I am Takshila. I'm one of the nurse in this clinic. Could you tell your name, please?
Yes, nurse, I am Jenny.
Oh, good morning, Jenny. How may I help you today?
Nurse, I'm here because, I'm really concerned about my daughter. She is becoming pale.
Oh, I am so sorry to hear that. Could you tell me about some details about your child? Like how long she has been pale of her skin?
Uh, yes, nurse, she has been pale for the last, uh, 2 days.
Okay. Then could you tell me, are there any general symptoms like fever with her?
No,
Okay, thank you. I got your point. Uh, Alexa, do you know anything about pale color of the skin? Do you know any this condition? Anything about this condition?
no, I don't know.
Okay, don't worry. I'm explaining you. I'm reassure you. This is called as a jaundice. This is normal within first 2 to 3 weeks of the in newborn baby. As a result of their liver is not mature enough. Do you get my point?
Yes, but you told me the liver is not mature, but one of my friends told me that this kind of jaundice is due to breastfeeding. So I stopped, breastfeeding my baby.
Oh, I can understand your situation. I think you are very stressful situation are you in. I can understand, but breastfeeding is the not the cause of this condition. I think your friend giving wrong information to you. How is that sound?
No, she is my very good friend. How she can give me wrong information?
It's maybe, but I think she also don't know about this condition. This is very wrong condition because breastfeeding is very essential to this condition. I'll explain you accordingly. I think you don't know. You and your friend also don't know because you are not the medical profession. But don't worry, I'll explain you accordingly. Uh, is that okay with you?
Okay.
Okay. Breastfeeding is a very essential thing to this condition because if you are not giving breast milk to your child become dehydrated. It is very close to about this condition, this pale color skin, and breast milk is giving so much advantages to your child. Do you know anything about that?
No.
Okay, don't worry, I'll explain you. Breastfeeding is increase your child immunity. It's prevent from disease. And another thing, prevent from infection. Another thing, your breast milk contains so much minerals and proteins. It will provide your child enough nutrition. I think you got my point.
Yes.
Okay, then I'll explain you another thing you can do to prevent this condition. You can give sun bath to your baby early morning and afternoon within 15 minutes. Uh, I think it is okay with you. I think you can do it, no?
Yeah, I can do. Thank you.
Okay. Then I think I'll explain all the things about this condition. If you have any question, you can ask now.
Okay, don't worry. I don't have a question. Thank you.
Okay. Then thank you very much. I think you give breast milk as suction to your baby. I think this condition will disappear next 2 to 3 days ago. If you have anything again you can visit to me. Thank you very much.
Okay, thank you.
Okay.
Okay, so people on Facebook and on Zoom, what should be the score? Just write in the chat. Have you taken OET before?
Yes, sir.
What was your score in speaking?
C plus.
What?
Yes.
C plus?
Yeah.
What exactly?
Why, sir?
It was 300, 310, 320. What was the score?
The 320.
320. Okay.
Yeah.
Okay, so for me, it is C, okay? Like 280, 90, but don't worry, okay? We are here to learn, okay? Not to discourage you or not to give you any comments, okay? We are here to learn, okay? So it could be C, C plus, but for us, C or C plus is equal because we need to get B grade, okay?
Yes, sir.
Yeah. So at the start, you don't say, could you tell me, just say, may I know your name, please? How can I call you? Good morning. I'm Diana, one of the nurses here in this clinic. May I know your name, please? Okay. May I confirm your name, please? May I know your name, please? Okay, like this. Not say, could you tell me your name? It's not good, okay? I'm not saying it's wrong grammatically, but mostly we don't use this, okay? Then you asked me an open question. Could you please tell me a bit more detail, something like that, okay? So just keep it open because then you added, some closed questions. For example, if I call you, if you tell me that my son or my daughter has, jaundice, and I tell you that, okay, could you please tell me a bit more about her condition? Okay, so it is open question. If I say, could you please tell me a bit more about your condition? Since when she is having these symptoms? So then I'm adding, one open close question with one open question. So it would not be good. Okay. So please keep it open. If you start a open question, keep it open. Okay.
Okay.
So just say, then about jaundice, you will ask, could you please tell me where exactly is the pale color means is eyes, hands, okay, arms, what place you have noticed, where you have noticed, side could be where you have noticed paleness, mean at which part of body, okay, maybe like this. So duration since when she is having jaundice. Have you noticed any other symptoms like fever? No, nurse. Okay, okay, okay. Then you will say that as there is no explanation of what it is because jaundice is sometime common thing. You can tell me, okay. So you can ask, you can tell, okay, Miss Jenny. Let me reassure you that your daughter is having a condition that we call as jaundice, but it is normal to have this condition at this age in first 2 to 3 weeks. And it could be because her liver function of babies at this age is not mature. Okay. Okay, like this. Okay. So ask about feeding of the child. Okay. So could you please tell me if I tell you directly that I'm not feeding now, then you can ask, otherwise you can ask, could you please tell me what you give her to feed, how is her feeding, what to give, okay, what kind of milk you are giving, okay. So I will say I was giving breast milk, but I was breastfeeding, but now I stopped. So you need to then tell me that, you can ask why you have started breastfeeding. My friend told me that I should not breastfeed. Okay, this could be the reason. Then do you need, Miss Jenny, let me reassure you that in your baby's case, in your daughter's case, breastfeeding is not the cause of her jaundice. So please you don't need to stop it. Even breastfeeding has many advantages. Do you know any advantages of any benefits of breastfeeding? No, nurse. What are the benefits? Yes, first of all, let me tell you that, Miss Jenny, breastfeeding improves, increases immunity. Immunity is just defense of our babies. So if we breastfeed our babies, their immunity will be strong, and they will have less infections. Okay, okay. And apart from that, okay, so breast milk contains balanced amount of minerals and proteins that is good for baby's health. Okay, okay. Okay, nurse, is there anything else that I can do for this problem? Yes, that is a good question, Miss Jenny. Let me tell you what else you can do is you can take your baby to the sun. You can do sunbathing in the morning and in the afternoon, just for 5 minutes each time, 15 minutes each time. It would also help to relieve symptoms of jaundice. Just keep it natural, okay? Keep it natural as you are doing a normal conversation with a normal patient. Don't make it artificial. Many, OET students, doctors and nurses, they start, using some, terms, some, memorized phrases from YouTube, speaking feedback videos. So this is not needed, okay? You don't need to do this. Just use your own language. Just explain what is written on the role play, okay? Explain it very well. Use layman term, use simple language because you are talking with the patient, and explain things. Don't explain a lot of things in one go. Just explain one by one. Show sympathy. Make things clear and easy for the reader, okay? Don't give a lot of information in one go. So these are the things that can help you to improve, okay?
Okay, so I'll not practice after my exam within 1 month.
So don't
I
worry,
will
you need to,
did the exam in November.
so you don't need to worry. You don't need to worry, okay? You will improve, okay? With time, you will
Okay.
improve. So, but you need practice, you need feedback, okay? Practice with your friends, practice with other students, okay? Get, some feedback, so it would help you, okay? So thank you so much, all of
Okay.
you. So I will, our next free class would be after 2 days. So maybe on Saturday. So we need to decide what you want me to discuss in the that free class. So what you want? Speaking, reading, writing. People on Facebook, can you hear me? What do you want me to discuss on Saturday? Next class, free class would be on Saturday. What you want me to discuss? Writing, speaking, reading,
So reading.
reading. Okay, let's ask on Facebook. I will ask in the. Okay, I will post on my page, so you people need to reply. Just will comment below the post. So what you want me to discuss in next week. So we will discuss. Okay, those students who are in with me in the writing class, in the paid course, just join our normal uh, Zoom ID. So we are going to leave this class. Just join that. Thank you so much, all of you.